So Doc, as a veteran, and with regard to screening for colorectal cancer, what are my options? And we'll start there. What are my options?
As a veteran, our recommendations largely parallel, right? I keep talking about the U.S. Preventive Services Task Force. We have our own organization within the VA, the National Center for Health Promotion and Disease Prevention. They take kind of the same kind of approach to recommending screening tests, panel of options. I will say that, again, the two dominant approaches include colonoscopy and the fecal immunochemical test. And so those are, I think that is the way the vast majority of veterans are getting screened right now, those two tests.
And so the second one you mentioned, that's the at-home testing, right? I'm not doing a fit test at the VA. The VA is sending me a fit test. Well,
so that's a great point, right? So historically, for most of my life, I've been in VA over 25 years. Most colorectal cancer screening opportunities are kind of built within office visits, right? So you go see your provider. Historically, right, while this is changing, most people were using the electronic medical record called CPRS. Your provider, right, they're seeing you on an annual basis. They got a lot of things on their plate, but there was this colorectal cancer, if you were the right age, the colorectal cancer screening reminder would pop up. Maybe they would have some discussion with you and you would make a decision, right? And they could put in a consult for screening colonoscopy, or maybe, again, they're giving you a home-based stool test that you would take home and send back to the VA. But we've actually, just within the last few years, we're actually starting to take an approach that delinks the offer of screening with FIT from actually coming to see the provider at all, right? So historically, we've been doing, again, the fancy word, opportunistic screening, right? You talk about screening within the context of a healthcare visit, and then you order a test accordingly. What we're doing now, and again, this has been going on the last couple of years, is using, right? We have some idea about who's due for colorectal cancer screening, right? I mean, we provide the same way an insurance company knows whether you got a colonoscopy and some insights about what was done on that testing. The VA, right, in our electronic medical record knows your age and knows if you're due for screening. So we take that information, we do a little more refinement with it. Like, we try to get a good list of people that we think would be eligible for FIT screening. And so unlinked from an office visit, we go ahead through our VISN partners, we send out a mailed FIT kit. So what generally happens, and again, we've done this in a way, we've rolled this out across the country in a way where we're actually learning all the time about what works best and what practices we should use. But long story short, generally speaking, you're going to get a letter in the mail that says, hey, we think you're due for screening, and you're going to get one of these FIT kits coming in the mail real soon. We hope you'll do it. Now, there's like some phone number on there, and like if you think, these guys, I just had colonoscopy 2 weeks ago. These guys don't know what they're talking about. It's certainly possible. Maybe you had some test in the community that we don't know about. I mean, that would be an opportunity for you to say, hey, no, I don't need that test, and we'd update your records accordingly. But for most people, they get that primer letter that says, hey, a FIT's coming, and then within a couple weeks, that FIT kit comes in the mail and they have an opportunity to be screened at home. So this is a new program, this mailed FIT program that we've just rolled out over the past couple of years. And we really think it's right. It's not the only way to get screening within the VA. In no way would I want to discourage you the next time you see your primary care provider. If you haven't received our kit in the mail, of course, talk to your provider. There's nothing wrong about having a visit and talking about colorectal cancer screening. But if this FIT comes in the mail, yeah, we'd love for you to do that FIT because that gets your screening done even separate from your healthcare visit. Again, you're not required to do the fit. You can talk to your provider. Maybe what it does is it reminds you to talk to your, maybe you're like, oh, I'm not going to do this, but I'm seeing my provider next month. I'm going to bring this letter. I'm going to talk to them about it. That's fine too. Anything that improves screening. But this program, while we just started a couple of years, we've really expanded through our VISNs across the entire network. And at this point, we're sending out in the range of 40,000 fit kits per month. So if you're a veteran and you're watching this and you're between 45 and 75 and you're due for screening, certainly possible that you'll get mail from us. And yeah, we'd love for you to send that in.
And to specify, especially if it's someone that's never received one of these kits, it's a part of preventive medicine screening. Getting screenings is part of preventative medicine, which means this isn't the VA trying to dupe you into having to pay a copay. This is a free service that's provided by the VA. Yeah,
you're not going to get any charge for doing this at home mailed fit kit. So it's not that at all. It's our level best, because the VA is actually pretty good at colorectal cancer screening, right? Like if you look at rates of colorectal cancer screening in the VA and compare them to outside the VA, we actually do a pretty good job. That being said, we know there's people that are unscreened. And so that's who we're trying to get at with this intervention. And I'll just say it's not like we just created this idea and thought, oh, this would be fun to do. Let's try this. I mean, there is really great evidence from organizations that in some ways are similar to us, like Kaiser Permanente, right? That's a HMO that takes care of a population of people. Well, that's awfully similar to what VA is, right? Like we have I don't say closed group, but yes, we have a closed population of folks that we deal with. And so back in, say, 2007, 2008, Kaiser Permanente started doing exactly what we're doing, sending out these fit kits, right? Because Kaiser they know who's due for screening. They have, right, their internal records. And so they published a paper now maybe 5 years or so ago where they looked at how much benefit they got from adding this mailed fit program within Kaiser Permanente. And they showed that this program was associated with about a 50% reduction in colorectal cancer mortality within their population. Right.
And that's extreme.
Yeah. I mean, so again, maybe we're standing on the shoulders of giants. I don't know. Again, I don't, we had this idea. We're doing this. We are doing this based on what other folks have done with good success. We think the VA is a great place where this could work well. And so again, yeah, very much encouraging people to, if they get that opportunity, to take advantage of it.
And so how often, I mean, if I start this, I got a few other questions about this, but if I start doing fit tests as a veteran with the VA, how frequently am I going to have to do this?
Annually, every year. Now, again, other things could happen in your life, like we update who we think is due for screening every year. But the long story short is, if you're doing fecal immunochemical tests, that simple test without any of those extra DNA markers, the simple blood test, it's an annual test. So you'd expect to be getting at that cadence every year. We're sending you that fit kit. Now, and we've said this a few times, but I'm going to say it again. If the test is positive, if there's abnormal, if we find human hemoglobin, we find blood in your stool, it's time to get off that non-invasive train. You need colonoscopy at that point. So that is a really important thing. But assuming that your test is negative, and about, all comers, about 95% of the time it's negative, then you kind of stay in that pathway again until you age out of screening. You get a positive test, or again, if at some point you have a symptom and you're worried, of course you can get colon. I mean, like doing a screening fit test in 2026 doesn't preclude you from getting a colonoscopy later this year if you're developing worrisome symptoms. I mean, of course, like you're not disadvantaging yourself. It's just an opportunity to look for disease while you're feeling entirely well. I mean, that's what the program's doing. But if at some point down the line you need a colonoscopy for symptoms, or in discussion with your primary care provider, you say, you know what? I'm sick of reaching the toilet bowl every year. I want to get on the rolls for colonoscopy. Then you do just that. You talk to your provider. Like, we're not preventing that. This is an and one opportunity for you. And but we think it's a great way to reach people maybe who haven't been screened in a while for whatever reason, or maybe they're not that connected to the VA. They don't see us very often. They don't come very often. It's an opportunity for them to get screened.
With the FIT test, is it as accurate as a colonoscopy, or is it
as a one-time test? It's not as accurate as colonoscopy. Again, we've covered some of this ground, but I'll repeat it. Right, as a one-time test, the best test for finding colorectal cancer and polyps is colonoscopy. Full stop. Right, that's just the fact. Right, if people say to me, "Is colonoscopy the best test?" I say, and I'm not being sarcastic. Well, it's definitely the best test for looking in the colon, 100%. How could FIT testing compete with colonoscopy? The only way FIT testing competes with colonoscopy is in this programmatic sense.
The frequency
if you commit to it. Yeah, you got to do it every year. And then if you look over long periods of time, they're very similar. There's some, if you look at modeling, maybe you don't believe modeling, but if you look at the mathematical models, colonoscopy slightly better on the benefit side. But of course, there's some harms of colonoscopy too. And so the organizations that make recommendations recommend FIT testing and colonoscopy equally. So so not witchery. It's real endorsed test. And again, I get screened by FIT. I do that partly, I believe in it. But I also do it partly to honor the veterans that are in this randomized trial that I mentioned to you, this confirmed trial. They were just like me, right? They were at average risk for colorectal cancer. Somebody came to them and said, "Hey, would you be in this study?" And they allowed the study to determine their screening. And so kind of in honor of that, I had a colleague of mine essentially flip a coin for my screening, and it came up, I think it came up heads, but in any case, it came up FIT. So I do annual FIT. So I certainly don't think it's witchery. It's an endorsed screening test. I do it every year. And I think I'm doing the right thing for my body to prevent colorectal cancer by doing that.
So I'm veteran at home. I get a box from the VA. It's a FIT test. What's in the box, and what am I supposed to do?
Yeah, so you're going to get it's from us. It's in this envelope, and there won't be too much in the envelope. There's going to be kind of the return envelope that you need to put the FIT test in. It's going to include this little cassette that it's the stool collection device. And it includes some paper that you're going to put in your toilet bowl, because the goal here is to get we don't want you stabbing at stool that's at the bottom of the toilet bowl that's all wet. So again, speaking from experience, you unwrap that paper, you put that in the toilet bowl, you have your bowel movement, and then you have this little cassette, and you pull out this little probe out of the cassette. It's got grooves on the end, and you just put that probe right into your stool, slide it back into that cassette, and then package it up and mail it back. There's an envelope to mail it back. Now, for anybody, maybe they just got it today in the mail and this is really going to help them. Really important that you write on that collection tube the date that you collected your stool. It's in the instructions. And again, there's instructions in this package, but it's a biological test. And we want your test to get to the lab within 15 days. Well, the only way we know whether it got there within 15 days of your collection is you tell us when you collected it. And so we need you to write the date. But again, that's in the instructions, but I'm emphasizing it because our group, this mailed FIT program, we keep track of reasons why we can't process the tests. And that's a common reason, right? Somehow we don't have the date, or again, sometimes there's mail issues as well. But again, that part of the instructions, make sure you put the date of the test. But those are the things that are in it. The instructions, some paper you put in your toilet bowl, the collection device, then you package it back up, put it in the envelope and send it in.
When we send this sample in, we're specifically just being tested for colorectal cancer, or are we actually being screened for other things as well? Or is that it?
Only colorectal. So this test is a one-trick pony, right? It's looking for human hemoglobin in the stool. And so that's all that's going to be done with it. It's either going to be read, and it's a little more complicated in terms of how the test works, right? It's actually the machine reads a certain concentration of hemoglobin. So if the amount of hemoglobin in that specimen is above the line of concentration, it's read as abnormal. If it's below the line, it's read as normal. So again, the reading is dependent on the amount of hemoglobin in your stool. And when it's positive, you need a colonoscopy. But no, to answer your question straight away, no, it's only testing for hemoglobin in the stool, and it's only about colorectal cancer screening. There's nothing else we're doing with that stool sample.
Is there a time where it may not be good to use a FIT test? Like, is there a bad time and an optimal time, as funny as that may sound?
For the most part, any time is a good time to get your colorectal cancer screening. And again, to kind of reiterate how the test is working, right? At the end of the day, I keep using the hemoglobin word, like we're detecting hemoglobin. It's detecting blood in your stool. That could be microscopic. Like you can't see it, but like if you probe the stool, you're able to measure this small amount of blood in the stool. Now, if you know that you have hemorrhoids and your hemorrhoids are flaring and you're having rectal bleeding, well, the instructions say this. That's not a great time to do your FIT test, right? So that might be the one time. That being said, I almost want to remind, right, folks, like, I mean, if you're regularly having bleeding and you're ascribing it to hemorrhoids, well, you got to talk to your provider and get a colonoscopy. But again, if you're, if you're a woman on her menses, if you're a person that knows they have hemorrhoids and they happen to be flaring at this limited point in time, not a great time to do a FIT test, because it could be fooled by that. It's just detecting blood. Yeah, it's detecting blood. Now, what's the worst case scenario? Yes, you'd get a colonoscopy. We would recommend colonoscopy at that point. We would not recommend repeating the test. We'd recommend if this test comes up positive, pretty straight line, easy answer, get colonoscopy.
And that was actually going to be my next question. As a veteran in the VA, I send this thing off. Am I going to get a letter in the mail, or am I going to get a phone call? Am I going to get a text message? Am I going to hear directly from my primary care provider? Like, what's the next step if it comes back positive?
Yeah. So that's part of the way we've set it up. We have the test being ordered through your primary care folks, and so they're going to manage that lab test the same way as if you talk to them in the clinic and they did a FIT test on you. They're going to get that result back within that provider's office, whether it's the provider directly or the nurse who works with the provider. You'll be getting a call that your test was positive, and then that generates a consult to the GI department. So it should be a 1-2 punch. You should get knowledge about this important result. And so you get that from your primary care provider, and then you should be getting a call from the gastroenterology or the endoscopy department saying, hey, we got this request. You need to get colonoscopy. That should happen in short order. I think I alluded to it earlier, but once you have a positive test, right, that puts you in another category of risk, right? Like before you had the positive test, you had one kind of risk for colorectal cancer. Now that's increased by like 5 to 10 fold. I got blood in my stool. I got to get a colonoscopy.
So as a veteran, is it a standard that, 45, I have to wait until then? Or, is there a situation, maybe if my family has a history of particular types of cancer or cancer in general, where, you might start doing this earlier, or how does that play out?
So within VA, again, our recommendations just parallel what national recommendations are, which is if you're at average risk, you start at age 45. And so that's when you would make this decision. Again, we've been talking about the different options for screening. There are circumstances where you would start earlier. If you're in a circumstance where you have a first degree relative with colorectal cancer, like, your mom, your dad, your brother, if they have colorectal cancer, that can definitely change the age that you start screening. So waiting till 45 might not be right in that circumstance. So if you're someone who has a first degree family member, or there's a lot of family members with cancer, you definitely want to talk with your provider, because that might buy you earlier testing. And generally for people with a family history, again, for average risk people without the family history, it's a panel of options. For people with a family history of colorectal cancer in a first degree family member, we normally start 10 years younger than the person that had cancer. And colonoscopy is generally the tool that's used in people with a family member with colorectal cancer. So those are circumstances to start early.
And why is it 10 years?
It's partly based on data, but it's also partly based, I believe, on this kind of natural history story where, we think it takes a fairly long time to go from normal mucosa to cancer. And so you're giving yourself that buffer. You're hoping to find, you really don't want to find hey, my dad got, God forbid, he had colorectal cancer at 52. Waiting till 50, maybe I'm already developing cancer. If I start at 42, that gives me a chance to find these pre-malignant things, remove polyps, prevent cancer. So we start earlier because it gives you that runway to try to act through polyp removal to prevent cancer.
So with regard to the FIT test, if I don't really want to do it, and I just prefer to get a colonoscopy, that's not an issue, right? The VA is not going to say, no, you need to do this first.
Yeah, no, really important. And again, we've been talking some about the mailed FIT program. The mailed FIT program, is our attempt to get you an opportunity to screen in your home, in the comfort of your own home, without actually having to have a doctor's visit, or a visit with your provider, your PCP. But it doesn't disadvantage. This is not right. It doesn't. If you don't want to complete that FIT test at home because you really want to get a colonoscopy, you believe in your heart that's the screening test that you'd follow through with, by all means, talk with your provider, get a colonoscopy. Certainly, again, I work as a provider at VA Medical Center. We do screening colonoscopy too. So really, we see our kind of enthusiasm about FIT, our offer about FIT. It's built into this concept that getting screening options to veterans makes a big difference, that the absolute testing at the highest level, getting screened is the most important thing. But again, if you want colonoscopy, talk to your provider about getting colonoscopy. That can be done within the VA. We do screening colonoscopy at my center, all the time. So that is definitely an option for you.
You've got questions and we've got answers. Whether you served, are currently serving, are a caregiver, or a veteran advocate, the SITREP is your trusted source for information. Subscribe today at www.youtube.com/@VA Made Simple.